Okay, good morning, everyone. And those who have come at 9 o'clock, sorry, we had to wait a little. I'm told there is ESG session going on right now by Deloitte. ESG is the buzzword, so probably there are a lot of people there. It's early morning, so we don't have that many people coming in here. But I believe the reason why we don't have so many people signing up for this session is the title itself. I mean, what does it even mean? It's quite loaded, quite heavy. When you read through this, it's a mouthful as well to just speak about it. We will try and dispel this today. Essentially, the title may be complex to understand, but in easier words to explain, what do we do as a development sector professional when there is a disaster? How do we ensure that we help out or rebuild the communities that are affected by disasters? Ajay and I have worked extensively together in multiple disasters. We were involved, as United Way Mumbai, we were involved with tsunami rehabilitation. We worked extensively in 2008 Mumbai terror blast. We have worked in J&K floods, Kashmir floods, Tamil Nadu floods. We've worked in multiple other disasters as well. And we've been closely involved with COVID-19 response as well. And in all this, what we've learned, one of the biggest learnings that we've had in this is that we are not enough. The amount of resources, the amount of skill set or expertise that we may have, we, as a stakeholder, we are a tiny piece in the puzzle to address gigantic issues. For example, COVID-19, a disease that overwhelmed capacities across. Forget development sector. Entire government machinery broke down to respond to COVID-19. In this kind of a scenario, what do we do as development sector professionals? What do we do as an NGO, CSR functionaries, or CSR foundations? These are few questions that we will try and answer today. And we will try and keep it light. It doesn't have to be heavy. There are a few of us, so probably it can be a close-knit conversation as well. We'll want to have more interactions with you as well. It may sound like a masterclass, but essentially we are going to share our learnings, our experiences, and to an extent, our failures as well, while we were doing disaster response across. Are we good? Thank you. Okay, so we will cover a few fundamentals of disaster management because that's something that needs to be talked about. Then on, we will go on to talk about what multi-stakeholder partnership truly is. What are the different steps in which one can have a multi-stakeholder partnership? And then we have two case studies that we would like to share with you. These are live case studies that we have. These are people who are already working on the ground in a multi-stakeholder partnership. Disaster management, probably we all may know, it's a response to disaster, ensuring that we manage whatever crisis there is in a community. And as a development sector professional, essentially what all we do to an extent is disaster management. A family is in a need, a child who is malnourished, a person who has lost livelihood because of skill sets that they don't have, person who would have lost their businesses, women who work in on slums, running some business, micro, nano enterprises, they lost their businesses during COVID-19. What is it for them? That's a crisis for them. It's a crisis at the family level. It's a crisis at an individual level. And that is a disaster management that we manage in our own communities. So NGOs or CSR foundations, we do this day in and day out without understanding that it is disaster response, it is a crisis response. The magnitude may be at a family level or at a community level, but essentially this is what we try and do. And we also engage multiple stakeholders while we do this kind of a community response or a family level response. Fundamentals of disaster management. One thing that comes into our mind is relief, right? When we think of disasters, if there is a flood, one thing that we think of is, "Arey inko khana bhejna chahiye, kapde bhejne chahiye." Let's try and help them out through health checkups, make sure that they are not physically, if they have a physical harm as well, let's try and bring some kind of help for them, medical relief as well. And that's a relief-centric approach that has been talked about over decades, 80s, 90s, and in India specifically, we have looked at disaster management as a relief response-centric approach. And this has changed over a few decades. We are talking about 90s, early 2000s, and now as well, after COVID-19. Hyogo framework, it's a treaty that was signed by multiple countries across the globe in 90s, which talked about changing the shift from looking at disasters as just as a response mechanism. But it looked at prevention of disasters. It looked at preparedness of disasters, making sure that the disasters don't happen in the first place itself. So that is the kind of approach that has come in, and multi-stakeholder partnership is one of the aspects of disaster management in this. It also talks about building back better. Multi-stakeholder partnership looks at this kind of an scenario wherein we try and rebuild the communities in such a way that they are better than what they were before a disaster happened. One of the case studies of this is Kutch earthquake, Bhuj earthquake that happened. After that, there are a lot of interventions that have been undertaken which left the communities better than what they were before 2000, when the earthquake happened. And that's the kind of concept that we are talking about. And multi-stakeholder partnerships are a way, one of the ways to do this. A typical disaster management cycle, and this will come in relevant in the subsequent slides. It is a typical disaster management cycle. Disaster is in red. Whenever a disaster happens, we try and do a response. We try and do a long-term rehabilitation as well. However, there is a lot more that needs to happen before disaster, prevention or preparation. How do you ensure that we prepare for a disaster? Something like COVID-19, which came on our lives without even any kind of warning, we weren't prepared for something like that. But there are crises that we can be better prepared for, and we'll be talking about that as well. So this is a typical disaster management cycle. There are many more terms that can be added in this cycle. There's mitigation, which looks at reducing the damage of a particular disaster even before it occurs. So there are multiple concepts related to this. I wanted to share this as a context for everybody. These are the disaster trends. This is from the World Disaster Response Report, the World Disasters Report in 2020. And it basically looks at the kind of disasters that have happened. There is geophysical, earthquake will come here, there is biological, and there is climate and weather related. And if you look at over the decades, climate and weather related disasters have gone up. We all are aware about this. There is no need to preach to the choir here. Crisis, climate crisis is real, and it is affecting, having multiple disasters. What it also means is that climate and weather related disasters are disasters which are unforeseen, happen in geographies multiple times. For example, a geography that has drought will have floods in the next year. And you will wonder why something like this has happened. And what happens to the communities there? We're talking about a community that had starvation in summers is now being ravaged by floods in monsoon. And whatever rebuilding that they were trying to do in their lives, they are not able to do that. So multiple disasters striking. And in this, one lens that we need to look at is loss and damage. Because we have multiple disasters happening multiple times, what happens is the families, the communities can't really rebuild. They can't really prepare and they can't really come back to normalcy at all. And that is one lens that needs to be looked at. And multi-stakeholder partnership looks at this kind of a scenario as well. COVID-19 and development sector, there is no content here because all of us are aware of what happened in COVID-19. If you can raise your hand and say whether you have worked for COVID-19 response. All of us would have worked, right? We would have done food distribution, we would have done multiple interventions. And were we disaster management experts? Right? None of us were, right? We may be from development sector, we may be CSR functionaries, we didn't even know. But we all were involved in disaster management. One of the COVID-19, one of the salient features of COVID-19 was that it was agnostic, background agnostic. It affected everybody across. You talk about class, you talk about different kind of backgrounds, it affected everybody. However, it affected everybody differently, right? A lot of people didn't have the resiliencies or capacities to respond to this kind of a crisis, but we all worked in this. And one point that I wanted to drive home here is, being a development sector professional or representing social sector organizations, can we afford to say, if there is a fire in a community that we operate in, can we afford to say, okay, we work in education, fire management or helping the communities affected by fire is not our job? We can't really afford to do that, right? We can't really say that we work in a hospital, we can't take care of other issues that are happening in the community. So that's where multi-stakeholder partnership or disaster management comes into play. We have a pivotal role to play when it comes to disaster management. And in this, and we'll come to multi-stakeholder partnership in a bit, in this, business continuity management becomes operative word for many of us. We would have heard about this. It is a word, is a concept, as a practice. This is quite operational in a for-profit community. Companies look after their operations, ensuring that their critical business functions continue even during a disaster, so that they don't lose out on their operations and subsequently their profits. What about this? What about BCM when we talk of NGOs? For us, when you look at COVID-19, what did it do? It affected our operations, it affected whatever we were doing, and it affected majorly most of the communities that we operate in. And BCM becomes relevant in this kind of a scenario, especially for the non-profit organizations, because the kind of work we do, we can't really afford to even have a 1 day off. We are talking about treating malnourished children. We are talking about treating, underserved communities in hospitals. We are ensuring, climate effects are reversed. We are trying to do multiple things as development sector professionals. And a day off in our lives means communities suffer because of that. And that's why business continuity management becomes important. How do we, as NGOs, because we are resource crunched, we don't have a lot of staff members on the ground, we don't have the kind of wherewithal that a for-profit companies, for-profit organizations would have. In this case, how do we do business continuity management? BCM for us will mean that we work with multiple partners, even during disasters. We may not have the resources, but we will identify stakeholders who have the resources working on this. So this multi-stakeholder partnership as a concept is at the center of business continuity management when we think of non-profit organizations. Are we good till here? Right. I'll hand over to Ajay, and Ajay will talk about what multi-stakeholder partnerships are, and then probably we'll share a few more case studies with you.
Thank you, Anil. So before I move on to the multi-stakeholder partnership concept, wanted one or two contributions in terms of how did your organization, especially if there are NGO representatives here, how did you work towards business continuity during COVID response? Any specific sharings you would like to talk about? Can we have a mic there, please?
Hi, I'm Abhishek. I lead a social enterprise called Cine Community Initiatives, and we are not ideally an NGO, but we manufacture a nutritional supplement for malnourished children, pregnant women, lactating mothers, etc. So the one part of business continuity was to keep our factories running, to be able to continue to serve the communities that we were serving with our nutritional supplement. We had the double impact actually with COVID-19 and Amphan. We had the Amphan cyclone at that point of time. I remember we had to shut down, we literally shut down the factory for just 1 day because a part of the roof had gone off. But we didn't have electricity for the next 7 days and we had to run on a genset. But we still brought in people within the campus, kept all our workers, enablers within the campus with food and lodging. And we continued serving the community because at that point of time it was not just malnutrition programs, but we were actively participating in grocery kits and supplying to various states with our nutrition supplement because it was an essential service at that point of time. In fact, we've worked closely with United Way Mumbai as well at that point for various locations. So yeah, that was a challenge and something we learned every day, I guess. Something we were not prepared for, something we learned every day that there's a red zone somewhere, so we have to mitigate that. So yeah, we learned every day.
Hi, Anil. You are Anil, right?
Ajay.
Sorry, Ajay. So I am Vikas. I represent Akshay Chaitanya. So we were into the area of eradicating urban hunger. And until COVID happened, we were only focused in Telangana. And when the first wave happened, we decided that we have to go to other metro cities. We could only get our resources together to be there in a large way in Mumbai. And then we expanded in a very small way in Delhi, etc. So as response to COVID, we said, it is here to stay. We will have first, second, and third, and fourth wave. Luckily, we did not really have a strong fourth wave though. But then we decided that we got to build a centralized kitchen in Mumbai, or especially actually in other metro cities. So as a response to that, we built a large centralized kitchen in Mumbai. So we faced a lot of issues in terms of the administration allowing the construction to happen during the COVID wave. right? Allowing the workers to really be there at the site, etc. But nonetheless, with whatever cooperation, we were ready during the second wave. And in fact, that came as a huge savior because we could extend support to the vulnerable during the thick COVID second wave. Yeah, so that's what we did as a group. But what we focused on when our volunteers and our staff was going out in the second wave, ensuring that the programs are implemented, what the trustees told us is that you got to be taking care of their own safety, right? So we kind of went very, very crazy in terms of making sure that we were not leaving any stone unturned in terms of the safety of our volunteers and staff, because we are ultimately answerable to them as well, because they're going out to serve the cause. And then we also executed the program such that we were keeping the safety of the beneficiaries also in mind, because beneficiaries would come in large numbers for wherever we wanted to execute our program. Yeah, so that's what.
Thanks. That's an excellent example of what Anil also mentioned, building back better, using disasters as an opportunity to do even better or more than what we've been doing. Yes, sir.
Hi, my name is Rahul. I represent Swadesh Foundation. We work in Raigad in Maharashtra and now in Nasik. So obviously, none of us were prepared for this, this massive thing that really hit us hard. But it taught us a lot of things, and it taught us new ways of doing things too. So the rural community that we were working in, first we broke it into two parts. First, our employee safety was absolutely paramount. So, but being on the field was equally critical. So we divided our employee group into such people who are staying alone. And we asked them, would you like to volunteer to go on the field? Of course, we gave them the first shot through the government's help. And the people who are staying with family, we try to avoid them, but we use them to do calls to the villages that we work with. So we luckily had this concept called as village development committees. Just doing everything ourselves is not going to be sustainable. So we have these committees which are there in the villages. So we were in touch with them, and whatever message that we had to pass on, we were doing it through them. So technology, was a boon for us that really worked well. And some of our volunteers, obviously, who openly went ahead and worked with the community very closely. So that was the other good thing which happened. So I think, thinking out of the box and, really innovating and doing stuff was critical. And we did a lot of training for our employees also. So why waste this time? So a lot of training was done for our employees, which eventually then we did for the community too. So those are a few of the things that we tried, and it worked really well for us. Thanks.
Great example, Rahul. Thank you for sharing this. Because like Anil mentioned, COVID was a very unique case of a disaster where even the responders were among the ones impacted. Ramya, you wanted?
Yeah. So I'm Bhagya Lakshmi, and I represent a non-profit called Bangalore Food Bank. And that was one of the times where we were unprepared completely, to be very honest, because one of our programs is we work with non-government schools. Now with schools being shut, how do we reach out to the kids? Because we are addressing malnutrition, but we really could not do much. So what we did is we pivoted, we worked with a lot of our grassroots partners and community leaders and ensured that we model our meals into nutrition kits. And what we did is we had different point of contacts where the kids' families are, and there were some non-profits who were responsible to ensure that they can reach out to these kids, and we provide them with regular nutritional supplements. Of course, it was not a permanent solution, but it was an immediate solution to continue the nutrition program that we had initiated. So that was one way how we tried to maintain business continuity, if I had to
Excellent example of collaborations, how we could rely on multiple stakeholders in the community. So with that background, I will move to what is multi-stakeholder partnership. And like Anil said at the start of the presentation, none of this is theory. We have put this in our words, basis our experiences and our learnings. So what is multi-stakeholder partnership? This is collaboration among various stakeholders towards collective response to a given incident, especially because we are talking about disaster response through multi-stakeholder partnership. And who do we define as a stakeholder here? Anybody who represents broadly in a society, we divide the society into three broad sectors: the state or the government, the private sector or the market, and the civil society. So anybody representing any of these three key sectors who may be either directly, indirectly impacted by that incidents themselves. So these, we also call them quote unquote beneficiaries or the affected communities. The ones who can provide support in any manner to facilitate the disaster response, recovery, relief, any kind of resources, any kind of expertise, any kind of help that they can provide. And then there is a third set of stakeholders who may not have a direct role, but they definitely have a role to play in terms of influencing the decision making, influencing what are the needs of the community, what is it that is required, and how do we provide. All of us may have responded to various disaster incidents in the past, and we know if we are working in a particular village, we cannot ideally work without engaging the Gram Panchayat or the local Panchayat representatives in the entire process. So those are the set of stakeholders who would fall under the third category. The need, why do we need multi-stakeholder partnership? The fact at the end of the day, resources are limited and we need to work together to amplify or to ensure those resources are optimized. We need diverse set of resources, expertise, and one particular organization can never claim to have all of those. And therefore, to respond to such complex situations, we need collaboration of multiple such stakeholders who hold different set of expertise. Avoid duplication and optimize the available resources or expertise. Ensure uniformity and effectiveness of response. So we can't have people working in silos and somebody providing, say for example, food in response to a particular disaster, food that may not be healthy for the beneficiaries or healthy for the children that we are supporting. But just in the name of relief, if we end up providing such kind of support, that is not really going to help the community. So ensuring there is uniformity in such response efforts. Support the neediest and the most vulnerable. Often what happens is geographies that are impacted with disaster, they become challenged geographies. Access to the affected communities is often at stake. Organizations responding from the outside of that geography, from other areas of the geography, do not have the wherewithal to access to the interior. And often then, if we don't collaborate, what we may end up doing is, as per our convenience, as per our suitability, we may end up reaching only the limited. And then the news articles that talk about only certain sections of society being supported and certain sections being neglected. This also means that we are able to we are able to ensure all sections of the society are covered, especially taking into consideration their vulnerability index. And one very important aspect of any disaster response is that you need to know what are the needs on the ground. And we've always seen it takes a few days or a few weeks for it to unfold and to realize what are the real needs on the ground. And as a non-profit organization who may be present in that community, though working for a particular focus area, say education or health, we cannot afford to wait for the government to come up with that need assessment report. And this is where joint rapid need assessment has proven to be one very critical intervention that happens through multiple stakeholders. There are multiple organizations who are based in the geographies doing different sets of work, but they have the direct connect to the community. So their volunteers, their staff, their team members may be able to access those areas physically and provide inputs from the ground, which are more realistic than doing a superficial or a representative assessment. And it will still be rapid as well, time sensitive as well. So this helps us determine our direction for disaster response. Certain key steps, and we, in our experience while working in these multiple disaster incidents, we've realized that we've seen multi-stakeholder partnership evolving right from scratch, and how it has proven to be a success story. What's important to start with is mapping, and this is an ongoing process. This is never going to be a one-time process. So mapping of who are the relevant key stakeholders, and you can't undermine any stakeholder. Everybody will have a stake, or everybody will have a role to play. We, besides mapping the stakeholders, we also need to do the resource mapping or expertise mapping. That what are the sets of resources, expertise each of these stakeholders bring to the table, so that you know what is it that you have already available and anything that you need externally in terms of planning your response. The moment we have more than one party partnering, and this is not for any individual goal, this is working towards a collective goal that you want to provide immediate, timely, safe relief to the impacted community. One need to have certain systems in place, because everybody has a different agenda, everybody will have different objectives, different SOPs to function. We need to keep in place a common minimum agenda and ensure there are certain common standard operating procedures, so that there is minimum clash of interest, so that there is minimum dispute, or this will also mean ensuring certain basic principles to be followed. Say, no particular political agenda to be driven, non-violence, ensuring that we are not causing any harm to the community that we are supporting or we are responding to. So these type of SOPs will always come to play. Certain guiding principles that are already available for all our reference. SPEAR, the minimum standard for disaster response. SPEAR International has already laid a fairly comprehensive guide for disaster response. What are the minimum guidelines that one needs to follow? So as a multi-stakeholder partnership, we may need to agree and draw down certain SOPs or draw down certain guidelines that we all follow. Then what is again very important, obvious, is coordination. And this is where we've seen multi-stakeholder partnership, for the lack of right mechanism to coordinate, multi-stakeholder partnerships have led to a failure, or multi-stakeholder partnerships have not worked to the extent they were expected to. For this, what is basically required is to have a secretariat in place. We need to agree that certain organizations may take the lead only for the reason of coordination. We will have to have certain meeting frequencies decided, so that we are all able to share with each other the information at right frequency and are able to work towards that. This coordination, the secretariat, though we may have call it as the secretariat, secretary is a very formal, has a very formal connotation though, but it will have to be a very informal, non-threatening coordination mechanism. Only when we ensure it is non-threatening, no organization should be seen taking the entire limelight of the work being done, because that's one of the potential threats anybody would see. If I participate in this multi-stakeholder partnership, how do I showcase the work done by me to my stakeholders? Which is also important at the end of the day. If you have donors that you are accountable to, you may need to tell them what is it that your organization has been able to achieve. So that need should not be shadowed by in the name of coordination. Then comes reporting mechanism. Sharing of information, sharing of data is again another thing where there is often a fear of it being manipulated, is being misused by somebody else, it shadowing your own contribution. So ensuring that it is done in a non-threatening manner, we may also have to use technology to facilitate user-friendly data sharing. And there has to be standard formats, minimum information that you need, which are the geographies that these different organizations are working. In order for us to plan our response, then comes the unified response system. And this is where we request all the members of that multi-stakeholder partnership to contribute information in terms of what is their intervention plan. Is your agency going to work on education? Is your agency going to work on providing hygiene kits or dry ration kits? What are the resources you have available with you? And which are the geographies you are going to work on? Any needs that you have, need of support that you may have. And this information is what can be leveraged by the secretariat to facilitate the linkage between different organizations. We can avoid duplication of work, which can avoid overlapping of communities that we are working in, geographies that we are working in. Again, what are the overlying principles? There has to be mutual trust. If this is not in place, multi-stakeholder partnership or collaborations will not work. So that mutual trust, and which can be only achieved by mutual respect. We have to ensure that we respect each other in whatever capacity the stakeholders come to the table. They must be respected. One success story of such multi-stakeholder partnership collaboration. Any representative sitting in here are from Mumbai or Maharashtra? Have you heard of this MahaPeconet collaboration, which took place during COVID response? Okay. We missed including you in that process. Because like I said, stakeholder mapping is an ongoing process and never ending. So this collaboration, this platform is still open for more collaboration, more partnerships, and we invite you to participate in this. What MahaPeconet stands for is Maharashtra Partnership for Entrepreneurship, Citizenship, Ownership Network. The name itself will tell you this is a name that has evolved. It's not a pre-planned, nicely coined name. The name has evolved as we realize what is the agenda, what is it that we are coming together for. This is an outcome of what started as a WhatsApp group. We all know that during COVID response, availability of blood, availability of hospital beds was a crisis, was a major crisis. And a lot of humanitarian organizations came together to collaborate, to share information, to help each other with that information. And that is something what turned into subsequently a formal collaboration, MahaPeconet. The first intervention the various organizations started working on, this was started in Mumbai. And we know as soon as the lockdown was announced, which was a sudden decision, a shock to everybody, there was an outflux of individuals wanting to move out of the city. The transport facilities were limited, they were closed, they were shut. People were willing to walk thousands of miles so that they were able to reach their homes, which were their safer places. And in response to those lakhs of individuals, and I'm not exaggerating, those who in Mumbai would have witnessed these numbers, lakhs of individuals walking on the streets day and night with luggage on their head, children, women, elderly, everybody, were in dire need of immediate support. And that support was not to give them a permanent shelter or a temporary shelter. That support was give them footwear, give them food as they are walking at the place that they are presently available. And to do this, a lot of organizations came forward, and it required coordination. Somebody suddenly will put a message on the WhatsApp group, hey, near Fountain Hotel on Godbandar Road, we see 500 people waiting there and they have not had food for last 4 hours. Somebody immediately will respond, hey, we have cooked khichdi readily available and we are sending it in another hour's time. Another organization responding saying, hey, we have 5 volunteers who can go there and help with this distribution. So this is a typical example of how this coordination collaboration started. Today, this has become a collaboration of over 70 different organizations representing charitable organizations, community-based small grassroots organizations, donor organizations, corporates participating in this, citizen action groups, informal volunteer groups who have also been part of this. And naturally, the government bodies, so the district administration, the state administration have also been involved in this. And also large multilateral organizations like UNICEF. They were in fact one of the seeding organization providing support required for this formation. Key guiding principles of MahaPeconet: reaching the unreached, collaboration versus competition, which is very important in any collaboration effort, supporting the supporters. So during these sharings, 1 or 2 of you mentioned that how it was important to ensure safety of your own staff. When we had volunteers working on the ground providing food, this initiative was called Jeevan Rath. It was food on wheels or utilities distributed on wheels, where the migrants were walking on their way back home. And in order to do this, those volunteers were putting their lives at stake, at risk. And to do, the various organizations came forward to work on a particular insurance mechanism to ensure all these volunteers, whether formally employed or not by those organizations, were insured to ensure their safety or coverage of their safety. And this, one other initiative during this collaboration, United Way Mumbai worked on, was helping people get back home. The individuals who had chosen to walk the difficult path, we worked with the organizations to help identify individuals or families who were keen to leave for their homes, far off as Bihar, Uttar Pradesh, and worked with the administration to get the necessary approvals, passes for those vehicles. Worked with the corporates who would fund the cost of those vehicles with food, because this was at least minimum of 1 to 2 days journey, 24 to 48 hours long journey. And then ensuring that they were bidded a goodbye with dignity and not just to push them out. So that was one of the examples how with this collaboration we were able to reach out to 24 Indian states across India, and at least over 1 million people were directly impacted. This was during the phase 1 of COVID. Subsequently, we realized the power of this. The Disaster Management Act of our country has provision for inter-agency group as a mechanism to be formed at district level, at state level. And in Maharashtra, we have been for the years have been struggling to put together such an interagency group which formally works during the peacetime as well as works during the disaster time. But we've always ended up doing futile exercises which will not end up in success. But so again, some of the steps that we mentioned in the beginning were missing. We would often initiate those conversations after a disaster. Once we are done with the disaster response, we will say, hey, now let's get back and let's form a collaboration, which was also more of a artificial environment in which we were trying to push for collaboration. COVID did not leave us with any choice, but we were all forced to collaborate and work together, and in a geographic, regional manner. So probably that trigger is what worked better this time. And then there was a formal mechanism of a secretariat put in place. That secretariat ensured that it was a non-threatening coordination process. Some glimpses of the impact that we've been able to reach out. These are the mapping of various stakeholder groups who are present in different districts of Maharashtra state, who have been supporting and participating actively in the Mahapeconet partnership. The next success story, again, this is something that we ourselves experienced firsthand. I'll request Anil, since he leads the health initiatives at United Way Mumbai, how the COVID response evolved with multi-stakeholder partnership.
Thanks, Ajay. So this is, he said it as a success story. I would say this is our learning story. We've learned a lot in this campaign. But before we jump into this, just wanted to clarify this. I think probably we missed out clarifying what a collaboration and what is the difference between collaboration and multi-stakeholder partnership. Collaboration is with like-minded organizations, entities who come together to take care of one particular objective. A collaboration normally has a definite nature, a definite time period as well, and it addresses a specific problem. And it can be overlapped with multi-stakeholder partnership, but multi-stakeholder partnership has multiple stakeholders. Okay. Multi-stakeholder partnership, as the word says, takes care of, works with multiple stakeholders who have different kind of strengths and expertise. If you saw Mahapeconet there, we have public health department. We have worked with Mumbai police as well. Now these two departments don't interact with each other at all, and these are they're taking care of different kind of issues. But they were part of our network as well, and so that's the essential difference. The other difference is that all the stakeholders may not necessarily know that they are working with each other. In collaboration, we sign a formal MOU agreement. There is some kind of agreement that we usually have. In multi-stakeholder partnership, it is not necessary that I may know who all other stakeholders are. In the case of Mahapeconet, it's a structured partnership that we have. Everybody has come together, signed some kind of LOI agreement, pledge saying that we will do this. These are the functions that we will take care of. The next case study that I'm sharing is an unstructured partnership, wherein the stakeholders really don't know that they are working in multiple, as a multi-stakeholder partnership. And this relates to our COVID-19 vaccination awareness and facilitation. This is a campaign that we did across the country. We worked in around 12 states, 12 states for this, and we reached out to multiple people on facilitating and making them aware about COVID-19 vaccination. What did we do as part of this? And before I go into that, there are 3 concepts that we need to know about COVID-19 vaccination. First was vaccine hesitancy, right? When it came down, when it actually came about immunization, people were worried. If you have heard of this news story in Barabanki in Uttar Pradesh, people chose to jump in ponds so that they avoid the immunization officers in the villages. People chose to do that so that just, हमें नहीं लेना है, टीका नहीं लगवाना है. That was the rationale behind that. And we are talking about that kind of hesitancy in the early part of immunization cycle. And then suddenly there was eagerness, right? All of us went into this COVID platform. Everybody wanted to get the shot. People traveled, in fact, in Mumbai, people traveled all the way to Palghar, which is outside Bombay, just to get the shot, right? People set up devious mechanisms to ensure that their families and they get the shot as well. And and that was the second phase. And the third phase now is laziness. I'm sure few of us wouldn't have got third shot, the booster dose, right? And a lot of people, and we are talking about underserved communities, specifically there, people haven't got shot. Third dose is important, critical in the immunization cycle, but that hasn't happened. And this campaign looks at this kind of aspects. We reach out to people, try and convince them about the importance of everybody getting the dose and ensuring that we are immune or at least protected against COVID-19. And this also stems from the public health principles of, health of anyone, anywhere is health of everybody, everywhere, right? If COVID-19 proved this, somebody got affected in Wuhan in China and everything went into lockdown. And that's where the concept emanates from. So this is what we did. We reached out to multiple people. We had 300 plus project staff across the country working on this and reaching out to people, talking about vaccination. These are the few communities that we worked in. But essentially the crux of multi-stakeholder partnership, and this is what we built as we went along. This is not something that we signed up and said, we will work with multiple people. We thought we are talking about COVID-19 vaccine, so we will have to work with public health department, people who do vaccinations, and probably mobilize community members. Little did we know that we will have to work with multiple stakeholders, reach out to them and get their help in our mission of making sure everybody has the vaccine. Whoever these people, we of course work with public health department, public healthcare workers, ASHA workers, Anganwadi workers, A&M workers, unsung champions against COVID-19, fight against COVID-19. These are the stakeholders who have not been recognized truly. These are the ones who have reached out in the communities and got mobilized people. We worked with these stakeholders in villages. Anganwadi worker is a woman who is from the community. People listen to the person who is coming, rather than an alien person who is going from Bombay in UP and talking about COVID-19 vaccine. So they really were the true champions, and we worked with them. There was a capacity building session that we did with most of them, and we tried and helped them understand what COVID-19 vaccination was and how it works. Because when you go in the villages, the kind of myths we are talking about are, you can't even imagine. People had different kind of myths related to this. How do you dispel that? Was taught in those kind of capacity building sessions. We also worked with, in this, another aspect is vaccination centers. Which were these vaccination centers? We are talking about centers which are primary health centers in communities, specifically in rural parts. In Bombay, Bangalore, you would have found schools to be turned into vaccination centers. Then we will have public health nurses, vaccinators going and doing this. Working with them, taking them as a stakeholder in this process was another facet. The other one, and particularly pleased about talking about them as faith-based organizations. COVID-19 vaccinations had multiple myths. A lot of myths that were faith-based as well. And when we went along, I was giving you an example of Barabanki. In that kind of community, who will they listen to the most? Not somebody like me who is going to go talk about COVID-19 vaccine, not even healthcare workers. They will listen to people who they look up to. They interact with every day, and faith-based leaders, faith-based organizations were the ones who played critical role in this. When we were designing this project, we didn't anticipate that we will have to work with this kind of stakeholders as well. Elected representatives, we may have different kind of thought process about them, but elected representatives also played a major role in mobilizing communities for COVID-19 vaccination, and community members, of course. Other NGO partners, Ajay mentioned about competition versus collaboration. Here, the operative word was partnerships and collaboration. We will work with whoever will help us getting people to get COVID-19 vaccinations. And that's how our interventions were spelled out. We worked with community-based organizations. SHGs were another stakeholder that we identified and worked with. Women's group, women talking about vaccination in the family meant the entire family goes for vaccination. And of course, donors. There were multiple donors that supported us in this campaign with different reporting cycles, different budgets. People came up with, you have to work in 3 months only to get this done. There were a few more who were more consenting, who gave us 12 months to take care of this particular campaign. But all of them have different reporting cycles. And I don't need to talk to you about CSR implications and reporting related to that. But multiple donors coming together and we trying to explain them and demonstrate the vision related to COVID-19 vaccination was one of the other facets that we had related to this. And this is a multi-stakeholder partnership. Probably the donors don't really know which are the faith-based organizations that we worked with. Or the ASHA workers really doesn't know which are the NGOs that are working in that particular community. Because this is a stakeholder partnership where everybody is working for a common vision, but without getting formally registered, getting together. Unlike Mahapeconet that we just saw earlier. So in this manner, probably we worked with different communities and tried to get a vaccination to maximum people. If we didn't do this, I don't think we would have been able to reach out to so many people, to so many communities without this kind of collaboration or this kind of partnership. And this is the essence of multi-stakeholder partnership. We don't have the resources as development sector professionals. We don't have the resources, neither do we have time or the kind of staff members required to do this alone. We need to identify stakeholders who can do this better than us in any kind of a response. Specifically, COVID-19 response, a complex challenge which overwhelms everybody, and it is very difficult for one stakeholder to take care of. It is important that we work with multiple other people and identify and work with them. So that's the crux of the presentation. Thank you so much for your patience.
Now we'll open the room for question answers and other discussions. If you want to connect with both our panelists, please feel free to ask anything or discuss anything if you want.
So first of all, I must applaud the work that United Way does because we were doing a little bit during the COVID wave ourselves. We saw United Way everywhere, right? If we were going to slums, we saw United Way folks there. If we were going to hospitals to distribute meals to the patient family members, United Way was there with the masks and the kits and everything. So good job done. Just wanted to ask you guys one thing. How are you, see, one is obviously catering to the disaster whenever it happened, and you spoke of mitigation and prevention aspect of it. So as you said, there are disasters that one can really predict, right? If there's construction that has happened in the floodplains, we will definitely have that place flooded sometime soon, sometime in the near future. So how do you preempt, I mean, any examples there? How do you preempt certain such things, and then how do you really work to ensure that something like that does not happen? Or if it happens, you're fully prepared. So any one or two live examples that you've catered to will help to understand that aspect.
So preventing disasters or mitigating the impact of disaster by using the technology available or information that weather-based alerts that are available today. The technology is evolving. IMD is doing a better job day by day. We all have noticed this. And with that, what is important is such formations to remain in place in advance. And once that happens, dissemination of that information to the relevant stakeholders is critical. We have seen why talk about what United Way has done? We all know Odisha is a global success story. The mass evacuations that we have seen over the years in anticipation of the cyclones, it is a geography that is frequented by cyclones at least twice during a year, right? And the state has ensured that the interagency groups at district level, engagement of the local representatives is so frequent, is so constant. You cannot choose to stay inactive during the peacetime. And this is, I think, the key solution to that. You can't remain inactive. You can't deform that collaboration during peacetime. You will have to stay together. You will have to continue coordination. And that really provides these success stories.
Sorry, sir. The gentleman definitely has a question. That if I may ask you one last thing, what sort of collaboration do you have, say, with the administration of the cities or the states that you closely work with and that you keep live in the peacetime, such that it may fructify into a very handful partnership?
Mumbai Municipal Corporation is one of the administrations that we've been working very closely with, and especially during the flood response or the terror attack. And immediately after the terror attack, there was such a collaboration formed with the initiative of the Municipal Corporation, BMC. They formed this. After the response to the terror attack, naturally the need for working together did not exist per se, but we all realized that can we have a role to play during the peacetime. And that collaboration worked on development of a resilience indicator. How do we determine whether the community is prepared enough to take the shocks or trauma of an anticipated disaster? That can be measured by way of measuring the resilience of that community. And in order to do that, we all work together to develop a resilience indicator. How do you measure? A tool, a set of questionnaires which can be picked up and used by any community organization. You take a small cluster of community, implement that, conduct those questionnaires, collect the data, and that will tell you on a scale of 0 to 10, what is the resilience level of that community. So this is one example of what is that food for thought or the need for coming together, continuing to collaborate. One can work on various such initiatives to ensure that we continue to work even during the peacetime.
And just to add to this, we always keep asking a question, which is what's next? COVID-19, when we started, first 6 months was all about personal protective equipment. Na? We all were mobilizing N95 masks. We were providing food and things like those. We were providing a lot of, whatever the hospitals needed or the COVID care centers needed, we were providing that. And we could have already ended the interventions there. The next question that we asked was, what are you going to need next in terms of COVID-19 response? The next one was infrastructure. When COVID-19 happened, our public hospitals didn't have the kind of infrastructure that was required. Our healthcare workers in the hospitals didn't even know about COVID-19 protocols. And these are facts. There is something called as infection prevention control, which takes care of pandemics or epidemics within the hospital setting itself. And this was one of the things that we found wanting in the hospitals. The hospital nurses, the ancillary staff, I'm not talking about doctors or MDs, I'm talking about people who actually do the caring in the wards. They didn't know how to protect themselves. And that's how we realized that we need to do an intervention related to IPC as well. So that has helped us. And then again, we asked the same question, what next? Next was COVID-19 vaccination that came in. We didn't have this weapon when we started the fight against COVID-19. It came in, and that's how we have tried to keep ourselves relevant by asking those questions and trying to see whether we can mobilize resources or do something about that.
Good morning, sir, and thank you so much for this wonderful presentation and really impactful work that you guys are doing in United Way Mumbai, and thank you for your service, especially during the COVID waves. So my name is Bharat, and I run a startup called Climate Bee Ventures, and we are basically into flood risk management. And my question is very closely related to the previous one. Like, how do you engage with startups like us, who are looking to provide better visibility of flood risk using, let's say, high resolution drone and satellite imagery, etc. In both cities as well as industries and the township around the industries. Do you work with startups as part of your multi-stakeholder partnerships, and in what ways can a startup like us engage with United Way Mumbai so that we can then jointly work on projects with cities as well as with various industries? So that's my question.
Sure, I'll take that one. We would love to work with startups, honestly, because the lean model that normally startups have and the agility that with which you work with. Specifically in this kind of a scenario, MahaPecoNet, what Ajay shared about, is a classic model wherein you can partner, wherein the kind of value that you have to add in terms of technology is valuable there. And probably you should try and evaluate partnerships there to start with, and then we can look into that.
The other thing is, MahaPecoNet is just a regional collaboration limited to Maharashtra. But similarly, there are such coordination networks which are working pan-India as well. Sphere India is one such organization that works with the sole mandate of facilitating coordination of humanitarian response agencies throughout the year. That's another platform for you to reach out to. And startups, there is no different definition for that species of stakeholders. You fall under the private sector. You have the solutions that are required. You have the technology that is required. One small example, in preparation to the second phase of COVID, we were anticipating that, of course, that did not happen, but we were anticipating the schools will have to open up anytime soon. And when the schools open up, are the schools equipped with the hygiene and sanitation infrastructure required? As simple as a hand wash station. How many schools, forget rural, I mean that's quite far off a story to talk about. Talk of a BMC school in Mumbai, and whether you can imagine or visualize a safe, clean hand washing infrastructure available in those schools. It is not. To ensure that within the minimum time, that small window of time that we had between the COVID wave 1, wave 2, it was realized, the stakeholders realized, the next priority for us is to equip all the schools, all the public toilets with the safe hand washing infrastructure. There was a vendor based out of rural interior parts of Maharashtra from Yavatmal, who had worked on a very easy to set up hand washing station. In one of the exhibitions here, one of the stalls, you would see a very nice, fancy, easy to set up hand washing station. Of course, that's come out of a lot of research and market research. But this was a makeshift arrangement that this vendor had worked on. He was onboarded, he shared the methodology, the partners available on the platform, those who had the resources available, they adopted it, they implemented this. Thousands of public toilets, schools, were within a span of 1 month, were equipped with the hand washing facility, which was safe enough, ensuring COVID-19 protocol. You can't, I mean, you'll have to discourage use of hand so that it doesn't spread further infection. So use of foot pumps. So that kind of innovation was required, and only because of such a individual, don't know whether to call him a startup or not, but a very small scale localized vendor who had this idea, that idea helped everybody scale this up, take to scale. So certainly all such collaborations will be open to any innovations.